Hello class, my name is Dr. Ate Kiroji. I will today take you through this topic, quality in health care. First, we will start by our objectives. By the end of this lesson, we should be able to explain the meaning of quality in health care. Then we should be able to explain the importance of health care. And lastly, we will discuss the approaches that we use in Kenya for quality maintenance in the health system. Quality, what is quality in health care? Quality in health care, it means providing health services according to pre-established standards and procedures, taking in mind the preferences of the patient and the most current knowledge. We emphasize in quality of care, we emphasize the desired outcome, that whatever health care we provide must need the outcome we expect. For example, if somebody is suffering from malaria and we are providing the health care, we expect that this person, after we have given the medicines, they will be able to be cured and go back to their normal activities. That is exactly what we mean by the outcome, that whatever we provide will be able to restore the health care of the individual so that he can continue with his normal activities. And while we are giving these health care services, we have to ensure that we take the needs of the health patient. When we get an individual or health patient, and we know each person has special or specific health care needs. Even when you have people suffering from the same disease, they will have different kind of needs. And therefore, every time a patient comes, we have to talk to that patient and know what are the needs. For example, how far this patient comes. If we want that patient to come back, what assistance we can give him so that we make sure that we ensure that the health care, his or her needs are taken care of. And I also said that the health care we give or the health services we give must be according to the latest scientific knowledge that we have, so that we don't have to give somebody health care services that are outdated. And lastly, while we are providing these health services, we must make sure we do not cause any harm to the patient. What is the scope of the health care, of the quality function in a health system? We have three main scope that we are going to discuss about. We have to look at the human resources, the facilities, the supplies, the equipment, and a healthcare system requires to provide the standard of healthcare that we need. Second, we look at the procedures. How do we interact with our patients? How do we interact with our clients when they come for the service? How friendly are we? Do we make them comfortable? Do we make them wait for a long time without the service? Then we look at the actual delivery of service. And then we look at if the patients are provided with the health care that has been prescribed. The example I gave for malaria, if a patient comes and requires antimalarials. We have done the tests and we have made a diagnosis that this patient suffers from malaria, and we prescribe the medicine. Do we provide that patient with the most current medicine and explain to the patient on how to take that medicine? And lastly, we look at the outcomes. The outcomes we look is what is the health status of our patients after they have received those services. Generally, in the society, how are the people satisfied? Are the people satisfied with the services that are provided? Now let's look at why is quality important. Quality, we look at it that currently, for example, in Kenya, we want to roll out universal health coverage. Universal health coverage means we want every Kenyan to access health care. Wherever you are, any part of the country where you are, we want you to access the essential health services. That is what we refer as universal health care coverage. But we don't want to give any health services, but we want to give high quality health services. For those of you who know our Constitution, 2010 explicitly says that we must provide health care, or each person must access health care. But it goes to qualify that that health care must of the highest standard. That is why in our case it is very important, because we have to provide this health care in line with what the Constitution requires. The second thing we look at is that the health care costs are going up every day, and people are questioning every time why are the costs are going up every time all over the world, and including Kenya. We want to improve the efficiency. We want to improve effectiveness. The other thing is that we want to make our quality of health services must be patient-centered. Patient-centered means that these patients are provided with health services taking into account their specific preferences and their specific needs. And that health care must be accessible, acceptable, and timely. When we talk about timely, it means that we give you the health services when you need. We don't want you to delay, or we don't want to delay the intervention that is required. You know, for example, in surgical conditions, sometimes people are put on a list. You are told you are going to come after 6 months. Or somebody is told you have to come after 3 months. You are given an appointment, you are sick, you want your problem to be attended immediately. And through quality care assessments, that is the only way we can eliminate this kind of delays. We want our health services to be equitable. Equitable, it means that every Kenyan must access the services we are providing, regardless of the age, the gender, where you live, your race, your ethnicity, and everything. You must have equal health care services of the same quality. Whether you are living in Mandera, whether you are living in Turkana, you should have the same health care of quality as same as somebody who is living in Nairobi. The other big component of quality of care is patient safety. Patient safety is one of the most important things that we take care when we are looking at quality of care. This is because when you come to hospital or at any health facility, as I have said, we don't want to cause any harm to you. We want to make sure that we give you intervention, we give you services which will restore your health care, but not to cause more problems again. But it has been seen around the world that the harm which is caused in the hospitals, in health facilities, is one of the highest causes of morbidity or one of the causes of diseases. And it costs governments around the world so much money to treat people who have gotten injured or who have gotten any error during their treatment at the hospital in our setup. It is estimated that in the developed world, 1 out of 10 people who are admitted in the hospitals, normally they get some kind of harm, and that harm costs a lot of money to remove it. For example, in our recent past, we have had a lot of negative press about healthcare in our hospitals. The most famous one was when somebody was operated, we opened the head, and later on we found that he was the wrong patient. Those are the kind of errors we want to remove when we put our quality of care at the top of our priorities. We also want to make sure that our resources are appropriately used. When we talk about appropriate use of resources, we have 2 terms that we need to bear in mind. We have underuse, overuse, and misuse of resources. When we talk about underuse, it means that we are not providing the services the patient needs at the time they require that service. I gave the example I gave on malaria, and I said if a patient comes, he has malaria, we have made the diagnosis, we know that that patient requires antimalarials, then we don't give those antimalarials at the health facility. That is underuse of resources. We also have overuse of resources. Overuse of resources is when we provide interventions which the patient does not need. The most obvious example is when children come with cough to our health facilities and they have upper respiratory tract infections, which are normally viral in nature. Viruses, normally we do not have drugs to treat them. But very frequently, some healthcare workers give antibiotics to this kind of patients. And we all know that antibiotics will have no effect on the viruses. And because of that, we are misusing antibiotics, and that's why we call it overuse of resources. Misuse of resources is when we provide the right kind of interventions, but we provide it badly. For example, you have had sometimes in our healthcare facilities when people are operated to rectify certain kind of mistake. But then you hear somebody forgot some substances in the abdomen of that person. Here you see we are providing the right kind of intervention, but we have provided it badly because whatever you forget is going to cause problems later on for that patient. Now, what approaches do we use in Kenya to provide or to implement our quality improvement measures? We have 2 approaches. The first one is what we refer to as continuous quality improvement. And this has 5 processes, has 5 dimensions. The first one is process. We look at the process. How is the process organized? We make sure that all the steps in a process is taken care of and it is the right process that we need to look at. We ensure that the quality improvement is a continuous exercise. Quality improvement is not a one-time thing. Once you start it, it has to be continuous throughout. And in addition, we focus, in the process, we focus so much on the customer. Now, the customer, that is the second dimension, refers to both the customer in terms of patients and also health workers. Health workers are customers also to the health system, as much as the patients are also are customers to the to the health system. We mean health care workers are customers because a doctor who is working within a health facility will request for an X-ray for a patient, and that doctor will require that X-ray to be sent back to him. So it becomes a customer to the X-ray department, and that's why we call those ones are the internal customers. The external customers are the patients, the community who are using our health system. And normally we do surveys, either surveys in the community or exit surveys for the patients who are leaving the health facility to find out how much they were satisfied. We also do surveys within the health facilities to find out how the health care workers or health workers in that facility, how are they satisfied with the system. The third dimension is the data. We will not be able to know if we are succeeding if we don't have data. And therefore, what it means is that we must continuously collect data, analyze that data, and that data will tell us whether our interventions are correct and whether they are improving. The fourth one is employee empowerment. For us to be able to succeed in our quality interventions or in quality improvements, we must make sure that our employees, and that is specifically our healthcare workers, they are fully involved from the beginning to the end. And we expect that at all levels, from the lowest to the highest, that they are involved through training. And the last one is we have to make sure that we use our resources very strategically. Remember, I've just said here appropriate use of resources, and I've said the three terms where we have to make sure that the resources are appropriately used. And therefore, when you are allocating the resources, you must allocate it to the very strategic areas of the organization. Now, the continuous quality improvement framework has some steps that are being used in our system. We call them Focus BDCA. Focus BDCA framework, it stands for, first, F stands for find. It means finding where the problem is in the organization, where the problem is. Second, organize. O stands for organize. Here it means you organize a team. Once you have realized there's a problem somewhere, you select a team which is going to look in detail what this problem is and what is causing the problem. And that is where the team comes to understanding the problem. The team will look in detail where the problem is occurring, what are the associated factors with the problem so that they can understand it very clearly, and what are the causes, what are the factors which are causing, and what kind of interventions that are required. Once they understand the problem, then they will select what kind of interventions, what factors, what problems are we going to address. After they select the problem, then you move to the next. You plan. Once you have selected what you are going to do, then you must plan. What does plan involve? Plan involves coming up with the objective. Objective means what will be your target? What kind of situation will you see at the end of your intervention? So the objective will tell you how far you want to go. And once you have come up with the objective, you must come up with the strategies or the activities, a work plan on how you are going to reach your objectives. Once you come up with that plan, which has the objective, it has the strategies and the activities you are going to do to reach your objectives, and also it has the resources you require and the time you require, and it has been approved, the next thing you do is to do the actual implementation. We will discuss more in detail about this, and then the next is to check. Check means you analyze, you collect the data which I have said, and lastly, you act. Act means is that once you collect your data, you have to determine whether you have been able to solve the problem or not. The second framework or approach, we call it 6 Sigma. 6 Sigma has a number of dimensions. The first one is to define. Basically, define is to define the problem. Where is the problem? What's the cause of the problem? The second, measure. You have to look at what kind of measurements you are going to make so that you can be able to solve your problem. After you do those measurements, you have to analyze. Analysis is very important. Just as I've said before, without the data, you will not be able to know whether you are succeeding or you're not succeeding. So the second thing it emphasizes here is to analyze this data, create trends, and see how the trends are going on all your interventions. It will give you some way of looking. Then improve. Improve, it means that you specify the steps you take to meet your objective which you had already decided above. Control. Control, it means, this is the last one, that if you have done your interventions and you think you have improved, you must maintain those standards. It has to be a permanent feature. What are the kind of measurements we take? I have mentioned this before, but I want to give you specifically examples which will make you to understand it a bit better. When we talk about structures, what do we measure in the structures? For example, the staff. If you have an ICU and you want to know whether some of the standards have been met, example, it would be asking yourself, does the ICU has the specialist it required? So you go there and find out whether that specialist is there. What about the process? You look at the process in the interaction between the patient and the doctor. Does the doctor ensure that when the patient, if a patient requires cancer screening, that patient is screened for cancer? A patient may come with a different disease. But we have said this kind of patient, when you get it, don't lose the chance. Make sure you do the screening. That's the doctor do that. The outcome here is where you evaluate the status of the patient at the end of the intervention. Patient experience, I think I said this before, that here we try to assess what is the feedback. We get the feedback from the patients, whether they are happy, whether they think they were over-delayed, whether the doctors were explaining better, and what are their experiences, and whether they are satisfied. In Kenya, we have what we call Kenya Quality Model for Health. This is the model we use to implement our quality systems. It has 5 principles. The first principle is system approach. System approach, it means that you look at a whole system, not one section of the process. Process orientation, we do all the steps that are required in that process. Leadership is the one which provides resources. Customer orientation, I've explained this. Involvement of the people, we have mentioned this, and that continuous quality improvement is a continuous exercise. This quality has 3 steps. That is total quality, there is 5C, there is CQI, and then there is total quality management. It is done in various steps. The first one is to look at the environment where the people are working. The second is the Kaizen philosophy, and the third one is total quality management. Now, the 5S, they stand for sort, set, shine, standardize, and sustain. It means that you sort, you improve your work environment to help people work better. And remember, I mentioned this PDCA cycle is what we use to make sure that we implement the quality system. I have already explained those 4 steps. And then total quality management, it means that where you involve the whole organization. Everybody is involved, from the CEO to the lowest staff and the community which are using the services. And this is the scoring we have in the Kenya Quality Model for Health. When we are assessing whether you have met the standards, we give you 1 mark if you have done nothing to set the standard we require. We give 2 marks if you have not done anything, but there is something, a memo or something, which shows that you are thinking about doing something. Number 3 is that you have met the minimum standard. Number 4, you have exceeded the minimum standard. And number 5, you have exceeded the minimum standard and it has stayed at least for 1 year. Thank you. That is the brief about the quality healthcare in Kenya. See you next time.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then, email all the above to apply@mku.ac.ke.